Have you ever noticed a change in someone you care about, a parent, a grandparent, a friend? Maybe they seem a little less energetic than they used to be, or they've lost a bit of weight without trying. It's easy to brush these things off as just getting older, isn't it? We tell ourselves it's natural, a normal part of the journey. But what if some of these seemingly small changes are actually whispers, soft warnings that something more significant might be happening beneath the surface? We often don't want to think about the difficult things, the realities of aging and mortality. It can feel scary, overwhelming, even a little morbid. But ignoring these whispers doesn't make them go away. In fact, it often means losing precious time when simple changes or getting a bit of help could make a world of difference. There are certain shifts in a person's health and behavior that are incredibly common as we get older. So common that almost everyone experiences at least one at some point. But for a significant number, they aren't just random occurrences, they are connected. Part of a pattern that signals a need for attention, for care, for action. What are these signs? These often overlooked signals. And why is understanding them so vital, not just for the person experiencing them, but for everyone who loves them? In this video, we're going to gently explore 5 of these very common warning signs, discuss what they might mean, and most importantly, talk about why paying attention to them is one of the most loving and proactive things you can do, both for yourself and for those around you. Understanding these isn't about fear, it's about empowerment, about having the knowledge to seek help and make choices that can lead to better health outcomes and a higher quality of life for longer. So, let's lean in together and learn. And please, stick around until the very end, because there's something I want to share with you that might just surprise you. Let's start with the first sign, one that often goes unnoticed or is simply put down to stress or eating a bit less. This is unexplained weight loss. Now, we're not talking about losing a couple of pounds because you've been trying to eat healthier or moving a bit more. We're talking about losing a significant amount of weight without any intentional effort to do so. When someone loses, say, 5% or more of their body weight over 6 to 12 months without trying, it's a red flag that shouldn't be ignored. For someone who weighs 150 pounds, that's a loss of 7.5 pounds or more. It might not sound like much, but think about what that weight is made of. As we age, we tend to lose muscle mass more easily, a process called sarcopenia. So, some of that weight loss could be valuable muscle, which is crucial for strength, balance, and maintaining independence. But unexplained weight loss can also be a sign of many other things. It could be something as simple as changes in appetite or taste buds, making food less appealing. Maybe chewing or swallowing has become difficult due to dental problems or other issues. Or perhaps it's related to feeling lonely or depressed, where the desire to eat simply diminishes. On the more serious side, unexplained weight loss can be an early indicator of underlying medical conditions that need attention. It could be related to digestive issues, problems with nutrient absorption, thyroid problems, or even more serious illnesses that require prompt diagnosis and treatment. The point is, when weight starts dropping off without a clear reason, it's the body trying to tell us something. Ignoring it is like ignoring the smoke detector because you don't see flames yet. The smoke is the warning. Why is it so critical not to ignore this? Because unintended weight loss, especially in older adults, is associated with a decline in overall health, increased frailty, a higher risk of falls, weaker immune function, and slower recovery from illness or surgery. It creates a kind of domino effect where the body becomes less resilient. Think about it. Someone who has lost significant muscle mass is less stable on their feet, making a fall more likely. A fall can lead to a fracture, which can mean hospitalization, and hospitalization can lead to a further loss of muscle and function due to inactivity. It can become a difficult cycle to break. So, what should you do if you notice this in yourself or someone you care about? The most important first step is to talk to a doctor. Don't delay. A doctor can help investigate the cause of the weight loss. They might check for underlying medical conditions, review medications as some can affect appetite or digestion, assess dental health, and talk about diet and nutritional intake. They can also check for things like depression or social isolation that might be playing a role. Sometimes, simple interventions can make a big difference, like dietary changes to increase calorie and protein intake, addressing dental issues, or connecting with social support services. It's about getting to the root cause and addressing it proactively. This isn't about cosmetic appearance. It's about preserving strength, vitality, and the ability to live independently and enjoy life. It's about recognizing that the body is signaling a need for help and responding to that signal with care and urgency. Unexplained weight loss is never just part of aging. It's a symptom that needs attention. It's a crucial warning sign we must not ignore. Now, let's move on to the second sign, one that is perhaps even more commonly dismissed as just getting older. Because who doesn't feel a bit more tired sometimes? But we're talking about profound fatigue or a significant loss of energy that is persistent and affects daily life. This isn't just needing an afternoon nap. This is feeling utterly drained, lacking the motivation or physical capacity to do things you used to enjoy or even manage basic daily tasks. Imagine someone who used to enjoy going for a short walk each day, perhaps tending to their garden or meeting friends for coffee, and now finds even getting dressed in the morning or preparing a simple meal feels like an overwhelming effort. They might spend much of the day sitting, feeling too tired to engage with the world around them. This level of fatigue is more than just tiredness. It's a pervasive lack of energy and vitality that impacts quality of life significantly. Again, it's easy to say, well, they're just getting on. But this kind of profound fatigue can be a symptom of numerous underlying issues that are treatable or manageable, and ignoring it can lead to a downward spiral. What could be causing this, like unexplained weight loss? The list is long and varied, which is why it's so important to investigate. It could be related to poor sleep quality, which is very common but often goes unaddressed. Pain, whether chronic or acute, can be incredibly draining. Underlying infections, anemia, low red blood cell count, thyroid problems both overactive and underactive, heart conditions, lung conditions, kidney problems, and certain types of cancer can all manifest as significant fatigue. Nutritional deficiencies, such as a lack of iron or vitamin B12, are also common culprits. Mental health conditions like depression and anxiety also frequently cause overwhelming fatigue. Sometimes the physical symptoms appear before the emotional ones are even recognized. Furthermore, many medications commonly prescribed to older adults can cause fatigue as a side effect. Think about blood pressure medications, sedatives, antihistamines, and certain pain relievers. Reviewing medications with a doctor or pharmacist can sometimes reveal a simple solution. The danger in ignoring this level of fatigue is that it significantly reduces activity levels, both physically and mentally. When someone is too tired to move, they lose muscle strength and flexibility, which increases their risk of falls and further reduces their mobility. When they are too tired to engage with others or pursue hobbies, they become more socially isolated, which in turn can worsen mood and cognitive function. It creates a vicious cycle where fatigue leads to inactivity, which leads to further decline in physical and mental health, which then worsens the fatigue. Breaking this cycle requires identifying and addressing the underlying cause. Why is this so critical? Because energy is fundamental to everything we do. It allows us to maintain our independence, to socialize, to pursue our interests, to care for ourselves, and to bounce back from illness. A persistent lack of energy robs a person of their ability to live a full and engaged life. It's not just about feeling a bit sleepy, it's about the profound impact on physical function, mental well-being, and social connection. If you or someone you know is experiencing this kind of deep, persistent fatigue, please encourage them to talk to a doctor. It requires a thorough evaluation to uncover the cause, but often, there are interventions that can significantly improve energy levels and quality of life. It might involve treating an underlying medical condition, adjusting medications, improving sleep hygiene, addressing nutritional issues, or treating depression. Whatever the cause, fatigue that significantly limits activity isn't just a natural part of aging. It's a sign that something is wrong and needs attention. It's the second critical warning sign we must be aware of. These first two signs, unexplained weight loss and profound fatigue, often go hand in hand, compounding their negative effects on health and vitality. Recognizing either one, or especially both together, should prompt immediate concern and a proactive approach to finding answers and getting help. Continuing on our journey of understanding these crucial signals, let's turn our attention to the third sign: significant changes in mobility and balance. This isn't just slowing down a little or feeling a bit stiffer in the morning. This is noticing a marked difference in how easily someone moves around, their gait becoming unsteady, needing to hold onto furniture more often, shuffling their feet, or expressing fear of falling. Perhaps they start using a cane they didn't need before, or struggle with stairs that were previously manageable. Maybe they have had a fall, or even multiple falls, which is a major red flag on its own. Our ability to move safely and confidently is fundamental to maintaining independence and engaging with the world. When mobility declines significantly, the world can start to shrink. Activities like going to the shops, visiting friends, attending appointments, or even just moving around their own home become more challenging and potentially dangerous. Why do these changes happen? And why are they such important warning signs? Like the other signs, decreased mobility can stem from a variety of causes. It could be related to musculoskeletal issues like arthritis, which causes pain and stiffness in joints. It could be due to loss of muscle mass and strength, which, as we discussed with weight loss, is common with age but can be exacerbated by inactivity or poor nutrition. Neurological conditions, such as Parkinson's disease, stroke, or peripheral neuropathy, nerve damage, often linked to diabetes, can severely impact balance and coordination. Inner ear problems can affect balance. Vision problems can make navigating environments difficult and increase the risk of tripping. Sometimes, it's simply a lack of physical activity over time, leading to deconditioning. However, significant or sudden changes in mobility are particularly concerning because they can indicate the progression of an underlying health issue or the emergence of a new one. Ignoring these changes is incredibly risky because impaired mobility and poor balance are the leading causes of falls in older adults. Falls are not just minor incidents. They can result in serious injuries like hip fractures, head trauma, and other injuries that require hospitalization and can lead to long-term disability or a significant loss of independence. The fear of falling itself can lead people to restrict their activities, which then leads to further deconditioning and weakness, creating another dangerous cycle. Someone who is afraid to move becomes weaker and less balanced, making them even more susceptible to falling. This sign is critical because addressing it can directly prevent potentially devastating events. If you notice significant changes in mobility or balance, or if falls have occurred, it is absolutely vital to talk to a doctor. A thorough assessment can help identify the cause. It might involve checking for arthritis, evaluating muscle strength, assessing neurological function, reviewing medications as some can affect balance or cause dizziness, and checking vision and hearing. Depending on the cause, interventions can include physical therapy to improve strength, balance, and gait, occupational therapy to modify the home environment for safety, reviewing and adjusting medications, using assistive devices like canes or walkers, or treating underlying conditions like arthritis or neuropathy. Encouraging safe, appropriate physical activity is also key to maintaining strength and balance. Even simple exercises like chair stands or supervised walking can make a difference. Addressing changes in mobility isn't about restoring youth. It's about preserving function, safety, and independence for as long as possible. It's about recognizing that difficulty moving isn't just an inconvenience. It's a sign that needs professional attention to prevent falls and maintain quality of life. It is the third essential warning sign. Moving on, let's consider the fourth sign, which often manifests quietly and can be overlooked because it doesn't have obvious physical symptoms like weight loss or difficulty walking. at least not initially. This is a loss of interest in activities that were previously enjoyed, or a withdrawal from social interactions and hobbies. Think about someone who used to love gardening, playing cards with friends, attending a club meeting, reading, or spending time with family. And now they rarely do these things. They might make excuses not to go out, seem less engaged when people visit, or simply stop pursuing their hobbies altogether. They might spend more time alone, perhaps watching television passively or just sitting. It's different from just wanting a quiet day. It's a persistent lack of motivation, enthusiasm, and engagement with life. Why is this a significant warning sign? Because social connection and engagement in meaningful activities are crucial pillars of healthy aging. They contribute to cognitive function, emotional well-being, and overall physical health. When someone withdraws and loses interest, it can be a sign of several underlying issues, and ignoring it can have serious consequences. One of the most common culprits is depression. Depression in older adults doesn't always look like sadness. It can often manifest as fatigue, irritability, loss of appetite linking back to our first sign, difficulty concentrating, and this pervasive lack of interest or pleasure in activities, known as anhedonia. Pain or discomfort can also lead to withdrawal. If it hurts to participate in activities, it's understandable to stop doing them. Fear of falling or difficulty with mobility. Our third sign can make leaving the house daunting. Hearing loss can make social interactions frustrating and isolating, leading someone to avoid them. Cognitive changes or the early stages of dementia can also lead to confusion or difficulty following conversations, making social situations uncomfortable and leading to withdrawal. The danger in ignoring this sign is that social isolation and lack of engagement are strongly linked to negative health outcomes. Research shows that loneliness and isolation can increase the risk of heart disease, stroke, depression, anxiety, and cognitive decline, including an increased risk of dementia. Being engaged in activities and connected to others provides mental stimulation, emotional support, a sense of purpose, and opportunities for physical activity. When these are lost, health declines more rapidly. It's a painful reality to see someone you care about retreat into themselves. But it's vital to recognize that this isn't just a personality change. It's often a symptom of an underlying issue that needs to be addressed. What can be done? Again, talking to a doctor is the first step. They can screen for depression and anxiety, check for underlying medical conditions causing pain or fatigue, assess hearing and vision, and evaluate for cognitive changes. If depression is the cause, treatment with therapy, medication, or both can be very effective. Addressing pain, improving mobility, or managing sensory issues like hearing loss can also make engagement easier. Encouraging gentle steps towards reconnection is also important. Whether it's a short visit from a friend, joining a small group activity, or pursuing a modified version of a favorite hobby. Sometimes, simply having someone check in regularly and provide encouragement can make a difference. This sign is about recognizing that a lack of joy and engagement isn't just a natural part of getting older. It's a signal that emotional or physical health needs attention. It is the fourth critical warning sign that we must not ignore, both for the individual's mental well-being and their overall health trajectory. Finally, let's address the fifth warning sign, one that is perhaps the most subjective but incredibly important: persistent pain or discomfort that isn't being effectively managed. Now, experiencing some aches and pains is very common as we age, often due to conditions like arthritis or previous injuries. What we are talking about here is pain that is chronic, significant, and impacts a person's quality of life, ability to function, sleep, and mood. It's pain that is often dismissed by the individual themselves. Oh, it's just my age, or I just have to live with it. But chronic, unmanaged pain is more than just a physical sensation. It has widespread negative effects on health and well-being, and is a significant warning sign that something is impacting the body in a way that requires attention. Why is persistent, unmanaged pain so critical? Firstly, pain is always a signal that something is wrong. While age-related wear and tear are common causes, Chronic pain could also be masking other underlying issues, such as inflammation, nerve problems, or even in rare cases, more serious conditions. Secondly, and perhaps more importantly, chronic pain has profound effects on a person's physical and mental health. It disrupts sleep, leading to fatigue connecting back to our second sign. It limits mobility and the ability to participate in activities connecting back to our third sign, which, in turn, can lead to muscle weakness and increased risk of falls. It often leads to social isolation and withdrawal, connecting back to our fourth sign, because it's difficult or uncomfortable to go out and socialize. And chronic pain is strongly linked to depression and anxiety. Living with constant discomfort takes a significant toll on mental well-being. People in chronic pain are often irritable, withdrawn, and can lose hope. Unmanaged pain creates a cycle of suffering that impacts every aspect of a person's life and can significantly accelerate decline. The danger lies in accepting persistent pain as an inevitable part of aging and not seeking help. While we may not be able to eliminate all pain, in many cases, pain can be significantly managed or reduced with appropriate treatment, leading to a dramatic improvement in quality of life. What should be done? This sign absolutely requires a conversation with a healthcare professional. A thorough pain assessment can help identify the cause and severity of the pain. Treatment might involve a combination of approaches. This could include medication management, physical therapy to improve strength and flexibility, and teach pain coping strategies, injections or other procedures, alternative therapies like acupuncture or massage, and importantly, addressing the psychological impact of pain through counseling or support groups. Often, it requires a multidisciplinary approach involving different healthcare providers. The goal isn't necessarily to be pain-free, which isn't always realistic, but to manage the pain to a level that allows the individual to function better, sleep better, engage more with life, and maintain their independence and well-being. Ignoring chronic pain isn't brave. It's detrimental to health. It's the fifth crucial warning sign that something is impacting quality of life and needs proactive management. So, we've talked about these 5 signs: unexplained weight loss, profound fatigue, significant changes in mobility or balance, loss of interest and social withdrawal, and persistent, unmanaged pain. These aren't isolated incidents. They are often interconnected, each one potentially exacerbating the others and collectively signaling a potential need for help and intervention. They are whispers from the body or mind, telling us that the current state of affairs is not sustainable, that something needs attention. Why have I focused on these particular signs and stressed why you must not ignore them? Because recognizing them early and seeking appropriate help can make a profound difference in someone's health trajectory and quality of life. It's not about preventing the inevitable. It's about maximizing the healthy, active, independent years. It's about addressing issues when they are more manageable, before they lead to crises like falls, hospitalizations, or severe depression. It's about maintaining dignity, autonomy, and the ability to enjoy the people and activities that bring joy. Think about it. Addressing unexplained weight loss can mean restoring strength and reducing frailty. Investigating profound fatigue can uncover a treatable condition that restores energy and allows for greater activity. Working on mobility and balance can prevent falls and maintain independence. Addressing loss of interest and social withdrawal can treat depression or other underlying issues. Reconnecting someone to their community and improving their mental and emotional health. Managing chronic pain can restore the ability to sleep, move, and engage with life more fully. None of these are small things. They are foundational to living well as we get older. Ignoring these signs isn't just a missed opportunity. It's potentially allowing health to deteriorate more rapidly than it needs to. It's allowing preventable issues to become significant problems. It's important to understand that noticing one or more of these signs in yourself or a loved one isn't a death sentence. Far from it. It's an opportunity to get answers, to seek treatment, to make changes, and to improve the quality of the time ahead. It's a call to action, a gentle nudge to be proactive about health and well-being. If you have noticed any of these signs, either in yourself or in someone you care deeply about, please don't dismiss them. Have a conversation with a doctor. Encourage your loved one to see their doctor. Express your concerns with kindness and support. Sometimes, just knowing that someone else has noticed and cares is a powerful first step. And that thing I mentioned earlier, that might surprise you. It's this often. The very best medicine isn't a pill or a procedure. It's connection, purpose, and proactive care. It's the simple act of paying attention, showing you care, and encouraging someone to seek help. That simple act can be incredibly powerful and can change the course of someone's health journey for the better. Remember, you are not alone in facing the challenges of aging. Whether for yourself or your loved ones, there is help available. And there is always hope for improving quality of life. Small changes, seeking timely advice, and focusing on well-being can make a massive difference. Don't let fear prevent you from being aware and taking action. Awareness is the first step towards better health and a richer life. If this video has resonated with you, or if you have experienced any of these signs and want to share your story, please leave a comment below. Your experience might help someone else who's going through something similar, and if you found this information helpful, please give the video a like and consider subscribing to our channel for more content aimed at helping you or your loved ones live your best life at every age. Thank you for watching and for taking the time to care. Live your best life, filled with awareness, health, and happiness.